And just for those of you who have joined us on Facebook as well, welcome to episode number 5 for tonight's Facebook and Instagram Live. So thank you for joining me. We'll just wait for a few more people to hop on. So I'll just do a quick intro. If you've never seen or been trained by myself, my name is Nancy Abdu. I am the CEO and founder of the Australian Dermal Laser Institute, and also been awarded for Best Educator for 2021 and 2022, very proudly so. We provide face-to-face training across Australia and New Zealand, and that is, like I said, face-to-face, but also online as well. So we can deliver both modes, and we deliver everything aesthetic devices, deliver training for aesthetic devices, and that includes IPL, laser hair removal, laser tattoo removal, plasma fibroblasting, radiofrequency, needling, RF needling, HIFU. We've had lots of inquiries for HIFU. I can see Joe's joined us. Hello, Joe. Fat cavitation, cryolipolysis, electrolysis, diathermy, epiblading, and so much, much more. And if you think you've had plenty of training, and you're wanting to upskill a little bit more, we also provide a wide range of pre-recorded workshops that you can watch anytime, anywhere, and at your own pace. We've got several workshops. One of our most popular ones is the rosacea and also acne and advanced IPL. I'm thinking of doing another advanced IPL as well. So we've had a few people asking for refreshers. What I'll get you to do is write in the comments box down the bottom what you would like to see me deliver, whether it is a workshop or whether it's a live. Anyway, on the 27th and 28th of February, so only 2 or 3 weeks to go, we will be delivering an amazing workshop. And when I say we, it will be tongue-tied tonight. It will be myself, Tanisa Williamson, and also Penia. I'll start again. Wow. And here, Kainok. We're going to be discussing inflammaging and stress, not just on the skin, but the whole body, and devices that you may have in your clinic that can help with inflammaging and stressed skin, and also stress. But apart from that, just devices, because that's who and what I love doing. We'll also be talking about internal and external health as well. So thank you for joining me. Today I will be taking you into a little bit of a deeper dive into wound healing. So all we do in aesthetics, not so much the beauty therapy side of things, but more aesthetics, is we create controlled trauma in the skin essentially. And with that, we should know the main phase. Apart from homeostasis, which is our very first phase of wound healing, who can tell me what the other 3 main phases that we're interested in as skin care practitioners or clinicians? Anyone can tell me what the 3 phases are? Azula Beauty, you're saying background noise is very loud. There's no noise at all. Unless it's my laptop. So anyone else have issues with background noise? All right, let me just have a look on this side. No? Okay. All right. So hopefully you can all hear me. All right. So what I want to have a look at, like I said, is there's a lot of background noise. How about if I move here? Oh no. Is that better? Perfect. Must be on the fan on my laptop. Okay. So if you just missed anything that I've said, you can go back onto our Facebook and have a listen to that little intro that we started with. But tonight we'll be talking about, good, everyone's saying much better, amazing. So everyone will be talking about, like I said, wound healing. And so the skin is the main barrier from protecting us from, often our hostile environment. So there's so many different things going on in our world, whether it's, environmental or mechanical stress. So upon injury, rapid closure of the wound healing and the actual wound itself and prompt regeneration of the damaged skin is critical to restore the barrier function. And effective repair requires communication between our cells and interplay between so many different cells in our skin. And this process is actually orchestrated beautifully. So thanks God for making our skin do what it does. So it is regulated at so many different levels. Now, the wound healing process is usually characterized by 4 different phases. And like I said earlier, who can tell me what these 4 phases are? I mentioned earlier we've got homeostasis. Well, what are the 3 other phases are there? Comment in the comments below to let me know, what are the 3 other phases do you think there are? Anyone? All right, so the 3 other phases that we've got are the inflammatory phase, the proliferative phase, so that's where proliferation occurs, and then we have our remodeling or our maturation phases. And if we have any disruption or deregulation to any of these phases, then impaired healing actually occurs. So, chakra beauty therapy. So we've got Marina. Hello, Marina. So we've got inflammation, rebuilding and strengthening. So nearly, we've also got the proliferation there, but thank you for answering. So we need to make sure that all 3 phases are activated adequately, so we don't actually have any scar tissue or have any I suppose, scar tissue essentially, or disruption. So I'm just going to quickly read this from a clinical paper. So it's just a real quick sentence, or paragraph rather. And if you're wanting this paper, I'll actually link it up to the bottom in the comments so you can see the whole paper. It's a really interesting paper. But this paper says transition from the inflammatory to the proliferative phase represents a key step during wound healing. The inflammatory phase is central, leading to homeostasis and recruitment of the innate immune system, which defends us against the attack of invading pathogens and help removes dead tissue. However, prolonged inflammation is detrimental and may result in deregulated differentiation and activation of keratinocytes, impeding the progress through the normal stages of wound healing. Severe inflammation has also been associated with excessive scarring. So when we have, it's really important that when we're creating trauma, whether it could be, is that a little bit better? So when it's from needling, RF needling, IPL, peels, whatever that it might be, that we're performing on our client's skin, that we're not over inflaming the skin, because if we do that, you'll actually end up with issues down the track. So the inflammatory phase usually lasts anywhere from 0 to 3 days. Any more prolonged than that can be detrimental to the skin. And so we want to make sure that if we have even plasma fibroblasting, actually that's another one, but if we've got any more inflammation, residual inflammation after that 3-day period, we to have our clients in for some red and infrared LED, preferably infrared if you have that, because that is known to reduce the inflammation. And if you have green LED, amazing. So green, red, or infrared will actually help with reducing that prolonged inflammation. So the proliferative phase is tightly connected to that inflammatory phase. All these big words today, huh? So really important, that we actually reduce the inflammation. And this is why when we do treatments such as our IPL or plasma or HIFU, whatever it might be that is creating all this inflammation, we're not adding to it. You don't want to take away from it too soon either. So many people that I have come across or train will possibly say do needling and then do a cooling, soothing mask immediately afterwards. If we're trying to induce collagen, so collagen induction therapy, by any means of creating that inflammatory response, any inhibition post-treatment within that especially first 24 hours, what are we actually doing? Are we reducing the efficacy? Are we potentially, inhibiting the fibroblast activity and production? So we want to be careful not to overinflame the skin, right? So that's why we say no sweating, no exercise, no spas, saunas, steam rooms, whatever it might be, for the first, 2 to 3 days. But we also don't want to inhibit too much, unless you're treating an inflamed skin. So if you're treating someone, say, with rosacea or with active acne and it's quite inflamed, then yes, go ahead, do your treatment and try to really inhibit that inflammatory response. But when we're trying to stimulate collagen, it's really important that we're not actually, over stimulating or under inhibiting that inflammatory response. So that's the first part of that inflammatory phase. Now, I'm just going to get a tiny bit more technical. If you want to get really, really technical, like I said, I'll put that paper. But I've just captured this from this clinical paper. So the inflammatory phase involves many activation of the innate immune system, neutrophils and monocytes, and they rapidly migrate to that injured skin. As a consequence of injury, resident cells, so for example, your keratinocytes, your macrophages, your dendritic cells, and the mast cells, are exposed to danger signals. Upon skin injury, these danger signals are recognized by pattern recognition receptors, which eventually lead to the expression of a large number of genes, including cytokines, chemokines, and antimicrobial peptides to initiate and perpetuate the inflammatory response. So there's quite a bit of a chain of event, a cascade of events that happen there. And this is really, really high level, so it's quite superficial. There's a lot more that actually goes on, and you've got your phagocytes that come in and your other wound healing and debris collecting cells as well that come in. So that's just part of that first inflammatory phase, if you like. Then after that, we have a proliferation, so the proliferative phase. Now, proliferation lasts anywhere, starts anywhere from, say, 5 days right up to waning. So it doesn't just stop at day 10, but it wanes off at day 10, and then it takes a number of weeks after that to completely plateau. So again, I'll just quickly read from this paper. As the inflammation subsides, proliferation becomes a major theme with the focus on covering the wound surface. So re-epithelialization. And this is where we're getting, skin at the epidermal layer, so granulating and forming. That restores the vascular network underneath and, like I said, forming the granulation tissue. Now, re-epithelialization requires migration and proliferation of the keratinocytes. Like I said, and that happens, it does happen from the beginning of that, where that wound healing, but the wound actually has started, but it peaks between day 4 to day 10. Generate more cells to cover the keratinocytes at the basal layer of the wound edge, and epithelia stem cells from nearby hair follicles or sweat glands start proliferating soon after that injury. Now, migration is triggered by the loss of contact inhibition and physical tension at cell adhesion structures. So, for example, your desmosomes and your hemidesmosomes, and they activate the membrane-associated kinases, and therefore they lead to increased membrane permeability for calcium. So there's a whole lot of reorganisation happening there, and also migration. And the migrated cells are released from the original sites by collagen and elastin. So with proliferation, again, particular during that period, that this is where red LED is going to be really, really important to ensure that those the mitochondria, the ATP in the mitochondria is doing what it's supposed to be doing, which is allowing that collagen and elastin to be released. Unfortunately, that particular collagen is what I call, in a simplistic term, your emergency collagen. So it's just being laid down. It's not, doesn't have a lot of strength to it, and it is not cross-linked, so it's just laid down really quickly. However, during the third phase, which is our maturation phase, this is where we start getting the cross-linking happening. So here, the remodeling phase starts at the end of the granulation tissue development, and we have mechanical tension and your cytokines. So for example, transforming growth factor beta 1, 2, 3, drive into the fibroblast to differentiate into your myofibroblasts, which express smooth muscle actin and start contracting the wound. So there's a whole heap there, like I said, that actually then go on. But during this maturation phase, which does anyone know how long that can take? Actually, maturation. If you guessed anywhere from, what do we say, 90 days right up to 180 is where it peaks. So 3 to 6 months is where it peaks, and then it wanes off. It can continue up to roughly 18 months. So once we have a wound, it doesn't just stop there and then. It'll actually continue for several months with the wound healing process, up to almost 18 months to 2 years, depending on the age, diet, lifestyle, and what skincare that person is doing and what are the treatments they're doing. So during this phase, we've got collagen type 3. And that is, like I said, it's cross-linked, it's stronger, there's a lot more, it's a better quality collagen. And so during this particular phase, we want to make sure that, the right skincare, more LED is being, the skin is being exposed to LED, but also nutrition. So I'm not a nutritionist, so I can't really tell you, but if you can actually maybe, get with or collaborate with a nutritionist who can help you with skin, then great. Top level, so really, really superficially, things like zinc, magnesium, NAC, so N-acetylcysteine, will help as well as essential fatty acids. So they're just a few things. Vitamin C as well will help internally. So there are a number of supplements that you could tell your client to be taking over that proliferation and maturation phase to actually help increase that wound healing response and proper maturation of the collagen bundles and fibers. So collagen type 1 has got a higher strength and it's more tensile. Just bear in mind, it does take a long time for that to deposit. The other thing that actually happens in proliferation, which I didn't mention earlier, is the stimulation of VEGF, so vascular endothelial growth factor. Really important growth factor, because your vascular endothelial is your inner lining of your capillaries. And so if we strengthen the capillaries and if we actually have more capillary network being introduced to the skin, who can tell me what then happens when we have more blood flow or what we call angiogenesis. Can anyone tell me what angiogenesis is and why it is really important, especially when we're delivering these types of treatments to our clients? While you write your answers, I'm just going to quickly check on over here. That's all good. Fantastic. Hey, Mary. So with VEGF, or with angiogenesis rather, what happens is we've got more blood flow. More blood flow means more nutrition to the skin, more nutrition. Here we go, ultimate skin aesthetics. The formation of new blood vessels, fantastic. Anyway, yes, so with the angiogenesis and more capillaries occurring in the actual area, like I said, we've got better toxin clearance, more nutrition, more oxygenation. And so when we come to perform these treatments and we've got better blood flow to the area, you'll actually get more growth factors as well. So whether it's, your different epidermal growth factors or transforming growth factors, beta-3 is what we're in particular I'm interested in, because that then helps produce that collagen. So just when we're treating our clients, making sure that those 3 phases, or the first 2 phases rather, and duration extended in any way, and we're feeding the skin internally and externally during that maturation phase. Really important that we're doing the right thing. So I gave you a little bit of a tip with internal health. Externally, during maturation, we could be performing other treatments such as needling, or your enzyme peels, even a retinaldehyde peel. So other more nutrition infusion treatments, or other treatments to actually help that maturation phase, is going to be really important during that period. So do we actually have any questions? No? I think it's a bit slow on Instagram, but that's okay. So the other thing that keeps on coming up is needling intervals. Some of you follow Des Fernandez, some of you follow Lance Setterfield. So with your needling intervals, maybe do your own research and have a look and see both papers. So there's a couple of clinical papers out there. If you type in needling intervals Des Fernandez, there is a clinical paper there that indicates, he actually suggests 7 to 10 days to needle again during that proliferative phase for maximum impact and effect, and you're wanting to needle to pinpoint bleeding. So that's the actual the interval there with Des Fernandez. Dr. Lance Setterfield is a little bit different. Lance Setterfield says that you need to needle every 6 weeks, so you're not disrupting that maturation phase. So yeah, maybe do a side-by-side or needle some, it's very hard to have 2 different clients, unless they're doing both exactly the same thing, to see how that wound healing process goes, depending on when you're needling them, every week or every 6 weeks. So we've looks like we don't have any questions, and hopefully that just gives you a real high-end overview of what happens in the skin when we're looking at wound healing, and what happens to skin, or what tips there are internally. Topically, don't forget skincare. I spoke a week or 2 ago about skincare, so getting your clients onto a vitamin A, a B, and a C topically is going to be really important. When you're utilizing, or when your client is utilizing both a good quality vitamin A and a C, it actually increases, it more than doubles the collagen production. when we're doing these aesthetic treatments. So make sure you get your clients on an amazing skincare and, of course, sunblock and a good hydrator. So a dry oil or a very good moisturizer is going to be also imperative. A hydrated skin is going to work and communicate intercellularly so much more better than a dehydrated skin. So, there are some people who will buy supermarket hydrators, and that sort of bothers me a little bit because what is in that, what alcohols, what preservatives, or what might there actually be in that particular moisturizer or skincare. So the best skincare is one that's prescribed by you as a cosmeceutical, and so lots of peptides, and also making sure that we've got your ceramides, or we've got antioxidants, because we are creating these free radicals in our skin when we are performing these inflammatory skin treatments. It's really important that we also have our antioxidants, so we're feeding and nourishing the skin, so we're not getting that prolonged inflammatory phase. In particular, inflammation we don't want, preferably no longer than the 3 days. So anyway, I'm going to love you and leave you so you can get back to your kids and everyone else in your family, and hopefully I will see you next week. Post on Monday what time for Wednesday. It'll be a little bit earlier in the day, but if you can't join me earlier in the day, the recording will be there on Facebook. Have an amazing week. Hopefully that gives you a little bit of an overview rather, and I'll see you next Wednesday. Take care. Thank you. Bye. My challenge is to turn it off now.